Pediatric vaccines and what you should know. What are vaccines? A vaccine is a product that is prepared to give your body a sort of acquired immunity against a particular bacteria or virus that happens to enter your body. You may be wondering why vaccines are important and necessary for your child. Vaccines provide immunity for your child. Without them, your child would be susceptible to the effects of several diseases and illnesses before their body could naturally build their own immunity. With the help of vaccines, your child can be protected from these diseases without having to go through their unfortunate consequences and even avoid the risk of death. In order to understand vaccines much better, let's discuss antigens and antibodies. An antigen is any substance or organism that is unrecognized by your immune system. It could be anything from bacteria to chemicals to viruses or even food. Antigens typically trigger an immune response, which consists of an antibody. Antibodies are proteins that bind with the antigen and neutralize it in order to make other elements of your immune system aware of its presence. Antibody-producing cells are specifically designed to tackle one type of antigen, and your blood, bone marrow, lymph glands, and spleen contain millions of them to ensure that you have the proper defense. Don't take this all for granted though. As impressive as our immune system is, it's far from perfect and needs our assistance to prevent harmful antigens from entering the body. Through hand washing, face masks, social distancing, and vaccinations, we can stay safe together. According to the CDC, it is estimated that due to the administration of vaccines to children born between 1994 and 2018, there has been the prevention of 419 million illnesses and 26.8 million hospitalizations. These vaccinations have also saved us as a society $406 billion in direct costs in healthcare. So as you can see, the administration of vaccinations not only benefits us in a health-wise aspect, but also in an economic sense as well. As you can see, the number of diseases that can be prevented by vaccines has increased steadily from 1964 to the current day. There are now 16 diseases that can be prevented by vaccines in the routine child or adolescent vaccination schedule. So when you hear people say things like, "We only had a few vaccines when I was a kid," it's okay to remind them that having more vaccines now means that their kids and our future generations are protected against more diseases than we ever were. So it's important for us to view it in this positive light. From the moment your child is born, there is a structured vaccination schedule that should be attended to with the help of your pediatrician. Take a moment to pause the video and scan the schedule if you like. History has shown us that vaccinations provide an unwavering benefit to us as a society. The mortality rate of certain diseases and ailments that have left devastating effects on us as a society in the past have drastically decreased in today's age. As you can see, smallpox went from having a mortality rate of 25,000 during the 20th century to a mortality rate of 0 in 2017. Measles, which had an outstanding mortality rate of 575,000 during the 20th century, has decreased to around 1,500. Pertussis went from a mortality rate of 200,000 during the 20th century to 15,000. And with these numbers steadily decreasing comes progress and hope that we can fully eradicate these harmful diseases. Vaccinations are steadily one of society's most cost-effective health interventions. Because of these interventions, UNICEF estimates that we have averted 2 to 3 million deaths annually. Although rates of recommended vaccinations for children have remained stable overall, the number of children receiving no vaccines at all has quadrupled from previous years. According to this report from the CDC, in 2017, around 1.2% of children younger than 2 years old had not received any immunizations at all. Even though this is a small number, this is still concerning and we need to improve it. This health education video was created for Project Access by SJVC RN program nursing students. Thank you.